And then I will have Megan just hand the room to make sure that I have 8 people present.
Yeah, there's a couple more people coming.
She's like, you're gonna have 25, and I'm like, are you sure? We can just have 8. That's fine.
There we go.
Come get some donuts before you sit down.
Sure.
Enjoy.
There's real Boston cream, I think maybe
She's obsessed with the Boston
She
cream,
is too.
so maybe don't eat the Boston cream. Alright. Well, I will go ahead and get started. You do whatever. My name is Nicole Roman. I am a radiologic technologist at Mount Carmel New Albany Surgery Hospital. I started there right out of school. I'm actually a graduate of Columbus State. Graduated in 2022, and Megan was actually one of my instructors as well. Today I wanted to discuss the importance of radiation safety with you guys. I'm sure you've gone over it a lot, but this is coming from me, who's done research and is working in a field where radiation safety is pretty important. So today we're going to discuss and understand the knowledge, attitude, and practice of radiation protection among healthcare workers, and it's a topic that I'm pretty passionate about. I'm very focused on it every day at work. So by the time we finish this presentation, I'm hoping that you'll be able to describe the fundamental principles of radiation protection, interpret barriers to compliance with radiation protection measures, apply radiation protection strategies in healthcare settings, your settings, evaluate the effectiveness of global practices, and design an action plan to improve compliance in your guys' healthcare facilities. And these objectives are going to guide our discussion as we go through. It'll probably take us about 35 minutes to get through it, okay? And as a radiologic technologist, I'm relied upon by patients and by surgeons during fluoroscopy-guided procedures. Radiation is a vital tool in modern healthcare, but it poses significant health risks to healthcare workers who are frequently exposed to ionizing radiation. It's estimated that 85%, there we go. It's estimated that 85% of the radiation humans are exposed to comes from naturally occurring sources, such as cosmic or radon. And then the other 15% is thought to come from medical imaging. Ionizing radiation exposure can lead to both deterministic and stochastic effects. You guys have learned about that. Deterministic effects are skin burns or hair loss, skin erythema. Stochastic effects are going to be cancer or genetic mutations. And this highlights why healthcare workers must adhere to the established safety guidelines to minimize these risks. So by a show of hands, put your hands up if you've used radiation protection devices like lead aprons or thyroid shields at your clinical settings. I figured, all of you, that's great. Raise your hand if you have had to ask somebody to put on a radiation protection device or stand behind one. Yeah, I figured. And then by show of hands, how many of you have had a delay in a procedure because somebody wasn't wearing a protection device or standing behind one, right? It sucks because then the doctor is looking at you, they want you to take that shot, but you're like, nope, can't. They're not protected. They're not standing behind a lead shield. I'm not progressing. And so that's why I'm here. We're gonna go over radiation safety, how you can enforce it and not feel like you're policing the room when you're doing it, okay? So there are 3 core principles to radiation protection. You've learned about ALARA: time, distance, and shielding, okay? Time is minimizing the exposure to radiation. Distance is the inverse square law, where we double our distance from exposure, we decrease our rate by, do you remember what it is? Yeah, 1/4. And then what's the minimum that you should stand from the source of ionizing radiation? 6 meters, yep. And then use of shielding like lead aprons or thyroid shields protect you and other healthcare workers from scatter radiation. And patient dose optimization isn't one of the original core principles, but ensures that radiation dose administered during a procedure is minimized without compromising diagnostic or therapeutic effects. This benefits both the patient and the healthcare workers involved in the room. And an example of this is when you're in a fluoro procedure utilizing a C-arm. Have you guys used C-arms much? Okay. So when you go in there and you're doing an extremity case, the very first thing I do, and that you probably do, you hit that pulse button and you hit the low dose button. Because what images you take that show up on that screen, the doctor's not going to be able to see a difference between whether you have pulse and low dose on versus not having them on. But it is significantly decreasing the dose to your patient and to everybody else in the room. I do a lot of total hip replacements, total shoulder arthroplasties. We do knees, we do a lot of hands and feet. I can make it through a total shoulder arthroplasty that has a fracture and use less than 3 milligray. That case, 2-3 hours. The max dose I'm coming out of there with, I would say is about 5 milligray, depending on the severity. That's pretty low. If I didn't have that on, that's unnecessary radiation to everybody in the room. So I'm going to reference this literature review quite frequently throughout my presentation because it was so big. A literature review by Besmar et al. 2020 covered 41 studies, and it included 22 countries. And it wasn't just radiographers, it was all different healthcare providers, auxiliary providers, radiology, and they found significant variation in healthcare workers' knowledge of radiation protection, ranging from as low as 2% to as high as 95%. And this particular one is focused on radiographers, so us. And in Nigeria, 95% of the radiographers included in this study had a sound understanding of radiation safety, while only 1 of 63 radiographers in Spain had an adequate knowledge. And these disparities, come on in, I have donuts and muffins, guys. These disparities highlight the need for standardized training across the healthcare systems to ensure that all workers are equipped with the essential radiation safety knowledge. So, quick question, how confident are you guys in your knowledge of radiation safety? Would you be able to answer questions from other healthcare workers if they asked? Because they're going to ask you. You're going to have a pregnant woman come up and ask if it's okay to be in the room. She's going to be concerned. And there are some basics regarding radiation safety that you should know. If you have the potential to receive anywhere from 1 to 20 millisieverts of radiation a year, you as a healthcare worker need to wear a dosimeter. Your total body dose annually should be less than 20 millisieverts, which is pretty high. And your total dose to the lens of your eye should also be less than 20 millisieverts a year, which is a pretty significant dose. Just to give you an idea, I'm in fluoroscopy guided procedures 3 days a week for 12 hours. I'll do fluoro procedures over in our department. My last quarterly dose was 4 milligram, which equates to 0.04 millisieverts. So I'm staying well below that recommended dose. But if you have the potential to be within this range, you need to be wearing your dosimeter. So let's talk about why healthcare providers or workers don't always follow radiation protection measures. even though we know how important they are. One big reason is discomfort. You've all worn the lead, it's heavy. And they're also uncomfortable. You go into a long procedure, you're not taking shots, so you sit down on your stool, you got that crease of the lead jamming into your waist, which pushes up on your thyroid shield, which pushes up into your chin. It's not comfortable. Ladies, we have the Velcro in the back that's pulling on our hair, and then you end up with this big mat in the back of your head. It's horrible. But we put up with it because we know the benefit of wearing that lead. Another issue is lack of training. Many workers don't receive regular updates on radiation safety. Sorry, just noticing like we had a lot of people filter in. So they either forget or aren't sure about proper protective equipment. And lastly, you have the institutional barriers, like not having enough protective gear available. This can make it difficult to comply, even when workers want to. They are hustling and bustling, and they don't have time to go searching for that lead. If it's not where it's supposed to be, they're gonna keep going. So it's clear both the personal and the institutional factors play a role in tackling these barriers, and it's crucial for improving safety. Now, I had a situation just 2 weeks ago where we had an institutional barrier. Well, potential institutional barrier. One of my coworkers went around, it was a slow day, and she rounded up a bunch of lead and took it into one of our procedure rooms to test it all, to make sure it was all still safe for our healthcare workers. So all of that lead got put into a separate room as she was checking it and filtering through what was good and what needed to be replaced. We had healthcare workers go in to get lead or go into the room where we keep it and noticed it was significantly depleted. They had a huge concern. Like, what happened to our lead? What are we gonna do when we have 6 rooms running next week and we don't have enough for everybody? We reassured them we do have enough. We have over 300 pieces within our facility to protect everyone. We're fine. We're just testing it. And we told them where it was. It will be returned. Whatever is still safe for you to wear is going to return to the shelf. We have plenty of lead left. But because there was the appearance that there wasn't going to be enough, we already created ourselves an institutional barrier in the mindset of our healthcare workers. It's been resolved. It's a non-issue, but we did have a little bit of a scare. So we're gonna take a look at how often healthcare workers actually follow radiation safety practices. And findings from that Besmar et al. Review indicate that compliance rates are all over the place, ranging from as low as 14% to as high as 99%. Depending on the region and healthcare setting. But when it comes to protective gear like lead aprons, they're highly effective, reducing your rate of exposure by up to 99% at just 0.5 millimeters thick. And just to give you an idea of things that are 0.5 millimeters thick, it's a grain of sand, it's a human hair, and it's a thin layer of paint or a piece of tracing paper. It's thin. But despite this, they're not always used consistently. Take thyroid shields, for example. These shields protect a very sensitive area from radiation exposure, but in some regions, only 7 to 69.9% of healthcare workers actually use them regularly. That's a huge gap. And so while we know that these devices can dramatically reduce exposure, the inconsistency of their use is a major concern. It shows that we need to do more as healthcare workers, or to make sure that healthcare workers are using these protective devices as part of their everyday practice. So now let's talk about dosimeters, which are an essential tool for tracking radiation exposure over time. There are donuts, guys. Come get some. These devices should be worn at collar level outside of your lead apron. and they help measure accurately your radiation exposure. And despite their importance, compliance using dosimeters is quite low, ranging from only 2.7% to 47% of healthcare workers regularly wearing them. And that's a concerning gap too, because they're so critical in monitoring your long-term safety. One reason for this low usage might be tied to prior knowledge and training. In the same studies reviewed by Rowantree and Curry, 7.5 to 61.9% of workers had sufficient training and knowledge about dosimeter usage. So the issue isn't just about having access to them, it's also about making sure workers are properly trained to use them. So how many of you are wearing your dosimeters regularly? Okay, yeah, I figured it was gonna be everybody. And that's part of the reason is because you're told to by your instructors. Part of the reason is because you've learned about radiation safety, and you wanna make sure that you're staying within safe limits for the duration of your career. The duration of my career, I just graduated in 2022, so the duration of mine is a lot shorter than yours, because I probably got 20 years on you. But I wanna make sure that I'm staying within safe limits, just like you do. Or you might have the situation where your boss is telling you to put your dosimeter on because Joint Commission is here and they wanna see it on every radiation worker or radiographer. And I actually, as much as I harp about radiation safety at my facility, that was me. I was the one that my manager told me to put my dosimeter on because Joint Commission was there. I was working that day over in surgery, and I was in between patients, and so I'm like, oh, I'll just pop over to the apartment. So I left my lead over there with my dosimeter on it, and saw my manager, and she's like, go, get your dosimeter, put it on, come back. Ooh, okay. So I went, ran over, got it, came back. They don't care if you're in the middle of a procedure, you have a patient, you're just sitting around. If you're a radiographer and you don't have your dosimeter on, Joint Commission's gonna ding you on not having that on. Dosimeters are crucial for monitoring cumulative radiation exposure and ensuring that we all stay within safe limits. And then when you start working in a hospital, I don't know, have they been supplying you with your doses? So you're getting comfortable with reading them? Okay. Well, when you get out to your healthcare facility, they're not gonna print it and give it to you. You're gonna need to access that information on your own. I have up here the login information for Mount Carmel for our healthcare workers. And this is posted in every single one of our break rooms, so it is easily accessible to everyone. And if your healthcare facilities don't have this readily available, please, please, please reach out to your radiation safety officer and get that information. Possibly suggest to them that they print it and hang it in the break room for other healthcare workers to have access to that too. Because just because you're taking the next step to ask your radiation safety officer for that information doesn't mean somebody else doesn't have the concern, they just don't know who to go to. So having that available to everybody is beneficial to all. So let's talk about the two main barriers healthcare workers face, the institutional and the personal. On the institutional side, some workers claim to not have enough access to protective devices. I had that scare at my facility. If lead aprons or thyroid shields aren't available, it's hard to follow safety guidelines even if they want to. They need to know the lead's going to be in that storage room for them to grab it and go. Protective gear like lead aprons can be heavy, so that's on the personal side. They're uncomfortable, especially during those long procedures. And a study in Thailand found that while 86.4% of workers wore lead aprons, only 68% used goggles, despite knowing the risks. Now, have you guys used lead goggles? No, because you guys aren't typically involved in long procedures when you're out at your clinical sites, would be my guess, with high radiation doses. But I don't want cataracts, so I wear mine during my long procedures. I don't wear them all the time because they are heavy and they are uncomfortable. But despite knowing the risks, people aren't wearing them consistently, 68%. So it's not just about the availability. Comfort and convenience play a huge role in whether or not workers wear that protective equipment. And it's your job to advocate for your fellow healthcare workers. And an example of this is, do you guys know what spinal cord stimulator cases are? Have you seen those? You've seen them? Okay. So we just recently started doing that at our facility about a year and a half ago. Up until then, we didn't have surgeons that did them. We just got some new surgeons. These cases, are you aware of the doses in your cases? What was the dose for your, you forget?
It was high though,
Yeah.
that's for sure.
They're significantly higher than even a spinal fusion. I would say the range for our spinal cord stimulators is from 70 milligray to over 300 milligray. And I take full advantage when I'm in that case. I wear my lead apron, my thyroid shield, my lead goggles. I use my extension cable, and I stand behind the shield as far away from that as I possibly can. Because they'll just be live the whole time. They're feeding that guide wire up to make sure they're getting to the right spot. I don't want that exposure. Nor do I want my fellow healthcare workers to have that exposure. They have to stand up there at that table helping guide that wire in. We didn't have goggles for our staff until about a year and a half ago. We started doing these spinal cord stimulator cases, and I'm like, no, I want goggles. So I went to my manager and I requested goggles for myself. I went to the surgical manager and I requested they order in at least 2 pair of goggles for our spinal cord stimulator cases, because we generally have 2 surgical techs on that case that can't leave that back table. Immediately, they ordered them in. They started wearing them. Well, then we got another surgeon that did spinal cord stimulator cases, so we would have 2 of them going at the same time. Well, damn. Now we gotta order in some more, because I don't want one room with them and the other room without. So we ordered in more than 2. I think they got in like 4 more pair, just in case. They got in the kind that go over glasses. They got in some regular ones to make sure that they're accommodating everybody. But that was how I advocated for my fellow healthcare workers, to make sure that they were safe. And that's what I'm hoping after this you guys will be able to do. So now let's talk about what makes radiation protection practices effective. First, regular training is crucial. Ongoing education helps keep everyone updated on the latest safety protocols, ensuring that knowledge doesn't fade away. Next, proper access to protective equipment is essential. If workers don't have the easy access to the gear, it's not possible for them to wear it. And lastly, those institutional support, the institutional support plays a huge role. So when organizations prioritize radiation safety, like our managers did by getting those lead goggles, and by providing those resources and fostering a safety of culture, because they did not hesitate. They ordered them in instantly. Compliance improves. And in short, effective radiation protection practices rely on that continuous training, accessible equipment, and institutional backing. So let's take a look at some key statistics on compliance with radiation protection measures. Research from the studies within that BESMAR review, it's 41 studies, so it was a large part of the information for this presentation. But it indicates that compliance rates for using devices like lead aprons and dosimeters range from 14% to 99%. Once again, huge discrepancy. This variation emphasizes the need for standardized education across all healthcare settings. And inconsistent training leads to gaps in knowledge and lower compliance. So there's a need for strong institutional policies to ensure clear guidelines and support for workers. So what strategies do you think would be effective, good morning, for improving radiation protection at your clinical sites or where you work? How many of you participate in radiation safety training at your clinical sites? Have you done, do you guys go to Ohio Health still? Mm-hmm. Yeah. So when you started doing those clinical rotations, you remember doing like a bunch of modules online? Yeah. Those are just regular annual training sessions. I'm sure there was a radiation one mixed in there. You might not remember it specifically. But that's because continuous training is key to maintaining the high standards of radiation safety. Once you get out into the work field, you're going to be doing it every year. They'll send you little reminders. You'll have to review your protocols for each different exam. It gets exhausting because you'll clear your email one day and the next day you come in and there's 20 because all of these exams have been reviewed and sent out for you to update yourself on. It's fantastic. To enhance compliance with radiation protection measures, healthcare institutions need to create comprehensive action plans. First, regular training is crucial. It should be an ongoing effort with frequent sessions to keep staff updated on the latest safety protocols and the importance of using protective equipment. Next, we need to ensure improved access to the equipment. Protective devices like the dosimeters and lead aprons need to be comfortable and readily available for everyone utilizing ionizing radiation. Developing strong institutional policies is also essential. Clear guidelines should outline responsibilities and foster a culture of safety where compliance is encouraged. And finally, action plans need to be tailored to each workplace, addressing specific barriers faced by staff. So whether it's discomfort of gear or lack of knowledge, by focusing on these strategies, we're all going to be able to significantly improve radiation safety in the healthcare setting. So now we're going to look at a review of cardiac imaging, and it was by Masala et al. 2019. And they discussed how effective radiation protection can be. The study found that regular use of lead aprons combined with frequent safety training significantly improved compliance among the healthcare workers. So this highlights that it's not enough just to provide the protective gear, but that ongoing education and training are crucial. And when workers received the regular training and were encouraged to consistently wear the lead aprons, compliance rates increased. And this shows how the continuous efforts of training can really make a difference. So ultimately, this case reminds us that improved radiation safety requires sustained commitment and engagement from all levels within the healthcare organization. So now let's discuss why continuous training is essential for maintaining effective radiation protection practices. While initial training is certainly important, it's just the starting point. Over time, practices, technology, and safety guidelines evolve, and so refresher courses and regular updates are necessary to keep healthcare workers informed and up to date. So think about it, if somebody learned about radiation protection measures years ago, they might not be aware of the latest and greatest that we have. They might think that it's still big and bulky, where actually we're ordering in the lightest weight lead that we can to accommodate that unnecessary weight and uncomfortability. Regular training helps bridge that gap. Ongoing education is not just a formality, but it plays a crucial role in keeping safety at the forefront of our practices. When workers receive that continuous training, as we just saw before, they're more likely to prioritize safety and feel confident in using the protective equipment. And this makes continuing training a standard practice, vital for fostering a culture of safety in healthcare and ensuring that everyone understands the importance of radiation protection. Our healthcare facility, I have a picture of a conference down here. Every first Friday of the month, we have a team meeting with our surgical team. And on occasion, radiology will come in and speak to our surgical workers, our healthcare workers, just to give them a little refresher on why we wear lead, why we use the lead shields, what kind of doses we're dealing with, just to help revitalize or rejuvenate their confidence and understanding in why they utilize those safety measures. So let's discuss some practical strategies to enhance radiation safety in healthcare settings. First, it's essential to provide healthcare workers with easily accessible and comfortable protective equipment. If gear is hard to find or uncomfortable, compliance rates are going to drop. A well-fitted, lightweight lead apron can encourage more consistent use. Next, we should integrate safety protocols into daily clinical routines. By embedding safety steps into everyday tasks, they become second nature. And simple reminders or checklists can help keep safety top of mind. And finally, remember that even small changes can make a big difference. An example of this, I'm sure you guys can tell I'm a pretty loud person. So we do PACU portables on all of our post-op patients. Before they can do PT, we gotta make sure that the implant looks good before they're up and walking around. So we do our PACU portables. A lot of my coworkers are kind of quiet. So they go, they get the patient set up, they're getting ready to expose, they step over to the side and they're like, X-ray. And the nurses are so involved in what they're doing, they don't hear them. And I know they don't hear them because they come to me and they tell me, hey, can you ask Luke to speak up when he takes an exposure? Because I didn't hear him and I would have liked to have been able to get out of the way. And I'm like, yes, okay. Well, something I do, and it wasn't even an intentional thing, it's just I'm a loud person. When I would go to take my x-rays, get the patient set up, go to take my exposure, look around, x-ray! Who's not gonna hear me, right? Like you can hear me in pre-op. I'm a loud person. Everybody has that opportunity to get out of the way. Even if they are focused on getting a handoff or getting somebody's vitals or whatever they could be doing, they have that opportunity to move. And it kind of became a joke. And then I had one of my PACU nurses start joining in when she saw me get ready. She'd start getting x-ray and just being a little smart aleck. Well, she's a friend of mine. So I didn't take it personal. Well, after she started doing it, one of the other PACU nurses started doing it. And now anytime we go to take an exposure, and it's not just me, it's all of our techs. We go to step away, and you will hear every single PACU nurse yell x-ray. I don't even have to do it. They do it for me. Or I'll walk over to them and just stand there and wait for them to say it. They yell it, everybody else starts yelling it. Or we just jump, or we dance. We do a lot of buddy system. We make it fun, but it gives everybody the opportunity to run. Sam will run all the way down the hall, around the corner, and yell, am I far enough? Like, we have fun with it, but we're being safe. We're making sure everybody is safe in that room. So now let's take a moment to think about what you can do to improve radiation protection in your own workplaces. You don't have to say anything out loud, just think about it. Because small changes like I demonstrated with yelling x-ray can lead to big improvements in compliance and safety. Everybody's getting out of the way. Everybody has that opportunity. I'm keeping them safe. One way I help is by surveying the room before surgeries begin. And I'm sure you guys do this too. because you're trained, as soon as people start walking into the room, you're looking around. Are you wearing lead? Do you have lead hanging on a wall? Do I need to get you lead? As I set up for my surgical procedures, people start coming in and I'm monitoring every single person. I hear that door open, I'm looking to make sure they have lead. Anesthesia, they're stinker butts. They never have their lead. So quite frequent, I shouldn't say never. Quite frequently, no. Every once in a while, I gotta be realistic. Every once in a while they don't have their lead hanging either on their anesthesia cart or on the back of their chair because they're busting butt from one patient to the other. They just don't have an opportunity to grab it. So I definitely keep an eye on them to make sure that they have their lead. If they don't, before the patient's coming in or before I have to do my first shot, I'm asking them, do you want red, blue, or not red, do you want pink, orange, or blue? And they'll tell me what lead they want. I bust booty, go get that for them, as well as a thyroid shield, because I want to encourage them to protect that thyroid. And I get back and I hang it up for them. I'm like, hey, it's hanging on the back of your anesthesia cart. Awesome, thank you. Sometimes people are like, I don't need it. And like, yeah, you do. Like, you're either gonna have, I'm either gonna go get you lead, or you're gonna stand behind this thyroid, or this lead shield before I take every shot. And if we have a delay in case, I'm calling you out. Because I don't wanna put on me. Anytime I have to delay a case because somebody is not taking, or not wearing their protective equipment, sorry, Dr. Roll, Corey doesn't have his lead on, or he's not standing behind a shield. I don't want that on me. And they get see during those cases. So I put it on them, and they'll let me get them lead. They don't want to keep getting up and standing behind that shield. So let's recap what we've covered. The fundamental principles of radiation protection, barriers to compliance and strategies to overcome them, the importance of continuous training and monitoring, and designing action plans for improving safety. And each of these elements is key to better protecting healthcare workers. So I encourage you to take what you've learned here today and apply it in your own healthcare settings. Improving radiation safety is a team effort. I think I've demonstrated that with our PACU portables. And together we can make a significant impact on protecting healthcare workers and the patients. So now I open it up to you if you have any questions or want to share any fun stories with protection at your facilities or just anything you've experienced. But before you do that, I do have references up here if anybody is curious about learning more regarding radiation safety. Hi.
Hello, how are you?
Good. But I can get you that information if you'd like afterwards, or just let Megan know if you're curious about any of it. Other than that, I want to thank you for your attention and participation. And if you have any questions, I will be happy to answer them.
I was listening out there. I didn't want to make you nervous by like hovering.
Well, we started and there were only 8 people, and I'm like, oh, we'll just go ahead and start.
It was an adventure getting here today.
Yeah. Oh, yes, that rain.
It was crazy.
But there are muffins and donuts, so please get food before Megan starts her spiel. But thank you, guys. Thank you.
Thank you for coming.
Oh, thanks for having me.
That's a great reading for them.
Did you hear me though?
I know. No, I just seen them. Dude, I waited in line for 30 I've worked every day
That was custard. This was custard.
Sorry,
You're okay. Sorry, you had to shut her down.
Went to talk to you guys, I can't talk very well, at 10.